Do you have time in your day to stay current with the ever-changing medical information needed to treat your patients? With your busy schedule, there can't be much. That's why nurse practitioners need UpToDate. UpToDate provides accurate, evidence-based clinical information and treatment recommendations you can trust quickly and easily. Join the growing network of over 2 million medical professionals worldwide who rely on UpToDate. Visit go.uptodate.com/NP15. That's go.uptodate.com/NP15 and use promo code NP15 to save 15% on a first-time annual or longer individual subscription. In this episode of the Nurse Practitioner Podcast, Jessica Van Meter discusses global health and disaster preparedness in low-resource centers. Let's jump right into the first question we have, because we have a lot to discuss today. Thanks for joining us, and would you mind describing your position at Vanderbilt? You have a very unique role within the medical center and the School of Nursing. How did that come about?
Thank you so much for having me today. It's kind of interesting. I just am so lucky to work with some really imaginative and forward-thinking nursing and physician leaders at Vanderbilt. And we really talked about how to balance global health initiatives, which are really at the forefront of what we believe nursing at Vanderbilt is, which is caring for our larger and greater communities, both here and abroad. And so primarily I practice clinically as a flight nurse with Vanderbilt Life Flight. I also work within the School of Nursing teaching community and global health to our new nurses. They're bridge students, so they're getting a master's degree in nursing. And then I work within our international division of emergency medicine, where I am currently positioned in Guyana in South America, where I'm the director of a bachelor's degree in emergency nursing program at Georgetown Public Hospital.
Thanks for sharing. It seems like you have a great passion for global and public health initiatives. What initially sparked that interest and motivated you towards that career path?
Well, my family background is pretty diverse. My grandmother is a Native American Indian, and so I was always fascinated with cultures and religions growing up. But I honestly think one of the most impactful things for me is when I started my master's education at Vanderbilt School of Nursing in 2005, Hurricane Katrina happened within 2 days, and I'm a native New Orleanian. And I think it really shaped me seeing my city destroyed and really brought to the forefront vulnerable populations, how access to primary care is essential even before a disaster happens, but most certainly after a disaster has impacted an area. And then the impact that multi-generational homes has on health in general. And I think we're seeing a lot of that with this current pandemic. But I would say the most impactful thing for me was Hurricane Katrina as I began my nursing career.
Thanks for sharing how your personal experiences and background have shaped your career. You've worked as both a nurse and a nurse practitioner around the globe. What are some places that you've practiced?
I had a great opportunity in nursing school to work with one of my fantastic nursing professors, and we traveled to the Balkans. And so the beginnings of my global health journey occurred in Bosnia and Herzegovina and in Serbia. And then thereafter, I've worked primarily in Haiti and the Dominican Republic, and now most recently throughout South America and mostly in Guyana. Before the pandemic began in 2020, I was averaging about 165 to 180 days abroad.
You mentioned the majority of your global health work has been in Guyana, South America. Do you mind describing some of the nursing initiatives that you've been involved in?
So Vanderbilt has long been involved in Guyana, and the roots of that started with an attending physician who grew up in Guyana himself. When he became a physician at Vanderbilt, he wanted to give back to the home that he loves and began recruiting other professionals who had a passion for global health. And so those initiatives began in early 2005. At the time, most of them were limited to physician education, and then transitioned to the start of the creation of a national EMS system in 2015. One of the reasons that we really started nursing initiatives there was it was the one piece of the clinical puzzle that was missing. And we'd done a lot of education with physicians, we'd worked with EMS, but this critical piece of nursing was left out. In most places around the world, the specialization of nursing is not known. You're a nurse and you float to whatever area the staffing requires. And what the literature really shows is that the specialization of nursing not only seen globally, but is essential to improve patient outcomes, improve teamwork, improve communication, job satisfaction, but most importantly, decrease patient mortality. And so that's kind of where I came in, and we really worked to identify what areas that nurses could be most impactful. And that started with trauma and emergency care. And so we developed some education that we hoped would really be a certificate program, and found greater investment than we ever imagined from the University of Guyana. And at that point, we were able to create a bachelor's degree program in which our nurses receive 2 years of didactic and clinical training and graduate with a bachelor's in emergency nursing after 2 years. So my nurses at Vanderbilt and nurse practitioners create the curriculum that was kind of formulated from the ENA, the Emergency Nurses Association. We help them implement it. We provide the clinical instruction. And then at the end of 2 years, their bachelor's degree is conferred by the University of Guyana.
Thanks for sharing that information about nursing around the globe and what you've helped with specifically. In light of the COVID pandemic, we've seen that it's greatly impacted everyone, especially in low and middle income countries where access to healthcare and resources are already stretched. It has also severely impacted travel. So how have you maintained a clinical and education-based global health initiative given the circumstances over the past 2 years?
Yeah, that was a real challenge. We had such a presence in Guyana, and as I mentioned, I had been traveling and was in country around 165 to 180 days a year. And so it was a difficult start to 2020 to transition what was such a personal, present program to an online initiative, and especially to create that kind of platform in a country without much online infrastructure. So to put things in perspective, my Vanderbilt School of Nursing students, we had much the same transition, but here in Nashville, Tennessee, we have the infrastructure to move online and move online quickly. And that was just not the case in Guyana. So even things like purchasing computers, getting a network available to implement Zoom education was a real challenge. The learning curve was of great frustration to my Guyanese students, many of whom do not have access to internet at home. So we needed to make some adaptations to our curriculum to ensure that they were able to not only attend class, but have access to those lectures while at work. We had a suspension of all Vanderbilt Medical Center nurse traveling faculty. There was increased social distancing within our class to decrease the spread of COVID-19 in Guyana. And so the class was then divided into 2 groups for education. That was a real struggle. Our admin schedules were alternated because our office space is small. So it was really difficult for me to even figure out who's there, who's at work, who can I send an email to. There were so many challenges. I will say, however, that once the platform was implemented, the nurses were so passionate about their education that they really rose to the challenge. And we've been able to continue to have successful classwork even abroad.
Well, that's great to hear. There have certainly been a lot of COVID-related challenges to overcome, and we're still facing them today. Are there some success stories that you'd like to share?
Yes, absolutely. The suspension of international faculty brought some formal proposals for the elevation of local faculty. This has been a huge blessing in the sense that it's allowed for these emerging leaders to really take a more concrete role. So we got some investment from the hospital, from the Ministry of Public Health, from the Institute of Health Science Education that sort of certifies all of our education to really put some time investment and honestly money into these emerging leaders in Guyana. We have 2 graduate classes now that were able to successfully finish all of their coursework despite all of these challenges. I even had a student who I'm so proud of. She literally had her baby on Saturday and then took our final exams on Tuesday. So it was just a real heartwarming example of how much continuing nursing education means to our nurses in Guyana. I could not be more proud of the obstacles that these nurses have overcome, and had the pleasure of watching my latest batch, the 4th batch, graduate on Saturday from the University of Guyana.
Well, congratulations to them. What are some of the unique struggles that nurses and nurse practitioners face when practicing clinically or providing education initiatives abroad?
Clinical work for nurse practitioners can be a little difficult in the sense that the role of the nurse practitioner is often not recognized or well defined abroad. Advanced practice other than midwifery and sometimes anesthesia is just not a thing. And so to be respectful of the countries in which nurse practitioners may be practicing, depending on the kind of partnerships that may be in place, it's really important to be respectful. And so oftentimes I feel like nurse practitioners can find themselves practicing at the level of a very capable registered nurse. Education, however, is wonderful in that I think nurse practitioners are uniquely qualified to provide high quality education. It's wonderful too in the sense that it adds to infrastructure building and sustainability. Some of the challenges, however, are creating the transition between well-established programs. For example, the American Heart Association's BLS, ACLS, or PALS in an area where some of the resources may not be available. And so in those cases, I feel like nurse practitioners are uniquely challenged to find a way to ensure that those skill sets transition from the classroom into the clinical area in a seamless way.
And on that same topic, the role of nurse practitioners as we see it in the United States is rather well defined. In areas of the world where the NP doesn't have a defined role, what are some of the advantages of utilizing nurse practitioners in global health initiatives?
I think nurse practitioners have a great ability to be adaptive, to be flexible, and to overcome obstacles to deliver patient and family-focused care. I also feel like our education as nurse practitioners really provides us the ability to balance much of what I do, which is a little bit of administrative work, a lot of clinical work, and then to really translate all of that into classroom and clinical settings.
Great, thanks for sharing. The pandemic has certainly brought public and global health initiatives to the forefront of everyone's lives. What would you tell fellow nurse practitioners who may be interested in getting involved in global health opportunities in the future? And is the ability to travel imperative to global health work?
That's certainly a question that I get most often. I would say that you really have 2 choices. So nurse practitioners can explore opportunities in global health that focus on clinical work with direct patient care. But then there are also opportunities in education. And so it's really finding what your personal preferences may be, because there are wonderful initiatives out there all across the world that do both. To answer your question about travel, the answer is really no. We have increased diversity in our own neighborhoods that allow for global health work at home. For example, here in Nashville, Tennessee, we have over 900 Afghan families that will immigrate to the greater Middle Tennessee area in the next year. And so there's some wonderful opportunities to be impactful without the travel component. When thinking about travel, it's really important to look at sustainability, however. And so if one is not really able to give 2 weeks to a month's worth of work, it can often be that those initiatives that are most sustainable require a higher travel demand.
Besides considering the timing, what kind of characteristics are important when exploring global health opportunities? Is there anything you particularly look for in initiatives in your practice?
Absolutely. A needs assessment is essential. That's where you're going to find out what the priorities of the locals really are. Then looking into who are the stakeholders for this initiative and how can this initiative improve capacity strengthening and infrastructure building. And those are just really fancy terms for how do we enhance or develop new knowledge, skills, and attitudes within the nursing profession. The biggest thing, honestly, is sustainability. Is this a program that's going to outlast just you? And does it have the cooperation and the investment of the local stakeholders?
In teaching nurses and nurse practitioners the foundations of global and public health, what are some things that you've learned in your practice that you regularly share with your US-based students?
I love this question because I get it a lot. And in fact, I get it so much that I created a lecture that I give my global and community health students at Vanderbilt School of Nursing, the top 10 things that I learned in global health. To narrow down just a few of those points, I would say that some of the real pearls that I have learned are that everything takes longer than you think it will, by a lot, that it's important to invest in your stakeholders more than your dissenters. I think that this was one of the greater mistakes that I made at the beginning of my global health, in that I spent a lot of time trying to convince people that what we were doing to specialize nursing education was important. To me, it's obvious. However, in spending more time with the stakeholders that were invested in what we were doing from the beginning, most of the dissenters got on board as our programs became more and more successful. Relationships matter. It's one of the reasons why I've spent so much time abroad in this work, is that though everything takes longer, the relationships that you form are really the things that are going to propel you forward when things get difficult. It's important to have really good support at home. People don't realize how hard this work is. And so having a good support system, both with your family and your work colleagues, is really, really integral. And one of the things that makes my students laugh often is that people who have no idea what they're talking about will give you their opinion and tell you what to do. And it's just really important that you ignore them. But lastly, this work is really hard. It's really, really hard, but it's so absolutely worth it.
Those are some great takeaways that you just shared. So thank you for that. And to close off the episode today, I wanted to ask, as you begin to transition this program to local leadership after spending a better part of 6 years, what's next for you?
This has been a topic of conversation amongst our international division for the better part of a year now. And, we started these nursing initiatives in the hopes that they would be sustainable at a local level. And so the development of our emerging leaders has been sort of the highlight of everything that we've done. I think it's important to create a really clear transition plan for them to help identify which of these emerging leaders will step up to take my place as a director, and really cultivate an environment where they can learn and I can maybe move into potentially a mentorship role. I certainly intend to stay involved in Guyana. One of the things that I would really like to do is work more with the identification of specialty nursing education on a national level. So when we started the program, emergency nursing was the first degree program in specialty nursing education, and that's not the case anymore. And I'm really proud to say that there's now a role for cardiovascular nursing specialists as well as neonatal nursing specialists. And I think in a country that has such high rates of maternal fetal mortality, as well as cardiovascular disease, these two specialty nursing programs, I think, are going to impact those statistics in a really positive way in years to come. But to get these specialty nursing roles identified within not only the Guyana Nurses Association, but also within the Ministry of Public Health is going to be really important. And I look forward to tackling those initiatives. And I think, too, just looking for other opportunities in global health. We have so many ties around the world with our international fellowships at Vanderbilt. And I look forward to exploring some opportunities in other places around the world. We have some initiatives in Mozambique and in Kenya and some work in Finland that we're doing. And then there's also some opportunities for nursing education in other places in South America. So I have my passport ready and I'm willing to go anywhere they let me come.
Thanks to everyone for listening. We hope you enjoyed today's episode. If you did, be sure to give us a rating in the Apple Podcasts app. You can find Jessica and her program at Vanderbilt Emergency Medicine on Facebook, Instagram, and their website. Be sure to also stay tuned for an upcoming publication in the Nurse Practitioner Journal. And you can find the Nurse Practitioner Journal on Instagram, Twitter, and LinkedIn. Thanks for listening. This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.